mitigation strategies. Next up, we'll hear from Dr. Pradeep Gidwani on some other stress-busting strategies related to mindfulness and supportive relationships.
Hello, I'm Pradeep Gidwani. I'm a pediatrician in San Diego. I work for the American Academy of Pediatrics, the San Diego Imperial County chapter, and I'm the medical director for one of our projects, Healthy Development Services, as well as a home visiting program called First 5 First Steps. So today I'm going to talk about some tips about how we can reduce stress in our pediatric patients. And of course, when we think about stress for our pediatric patients, we have to think about how we can help their parents. Both the parent and the child need to have the opportunity to regulate their stress. So one of the things that works really great for stress is breath work. And when you think about breathing, it's a way that helps us connect our emotions and our mind. And it helps us calm down and slow down. So depending on the child, you can do a variety of activities that I like to teach parents. One of my favorites is one where you actually draw on one side of a paper, you draw a candle, and on the other side, you draw a flower. You have the child smell the flower, then you turn the paper over and you have them blow out the candle. It's a really fun way for the parent and the child to interact. And of course, it also works for parents as well. So teaching parents how to breathe, just to breathe in through their noses and slowly out through their mouth, and watch them actually feel different as they're doing that. What's really interesting about that is it takes a really short period of time to do it. With parents, you don't need the visual as much as you do with children, but with kids, the visual always works beautifully. One of the things we have all the time handy is bubbles. Blowing bubbles is a great way to do the same piece. And again, what you're trying to do is help them slow their minds down and to be more present in their bodies. So actually, that's another piece that we do. Whenever we're talking about these pieces, we ask kids and parents to feel themselves in their bodies. And there's so many different ways that you can help kids and families get into their bodies. Particularly as kids get older, you can do things like push against a wall, touch furniture. Simple things where you can really teach ways for people to regulate. Another great one, particularly in this day and age, is going for a walk together. There's two things that happen when you walk together. One is you get into that rhythm of walking, and in that walking, it really helps us calm down, and it helps us really truly become grounded. So this whole piece about learning how to regulate our emotions and understand our emotions and how they work with our thoughts is so important for all of us. And again, kids can start learning these skills very, very early. So one of the things we like to do with kids as they get older is to use their imagination and to create a special place. So when a child is upset and they need a little time to collect themselves and get their emotions more clear, we talk about creating a special place. And that can be fun, and it really depends on the child. So if a child really likes animals, then they could go to a zoo, or they could go to the forest, and they could talk with animals. They can use their imagination. They can just have a lot of fun with this. Some kids like castles, and you can have this whole thing about going to a castle and who you meet there, and again, have them really think about things to really get their mind active so that they're really allowing their emotions to calm. One of the things we know when we have really strong emotions is it takes time to recover and it takes time for that to calm. Another trick that we use, particularly with younger kids, is the idea of a balloon breath. And so the idea around a balloon breath is you have them take their hands and put their hands on their belly, and you have them blow up their belly when they breathe through their nose, and then breathe out their mouth, and they let the balloon out. And so that idea is, again, very helpful, because what you do with that is the mind calms as we take longer breaths. Particularly breathing in the nose and out of the mouth really helps calm kids down. So that whole idea of having them think of their belly as a balloon, and they blow into the balloon, and then they blow the air out, and at the same time they have their hands on their belly and the belly goes down. So they get that really cute idea of really feeling how it works to do what's known as belly breaths. Another thing that's really helpful is to ask kids to check in with their bodies. And so what you can actually do is ask them to check into different parts of their body. You can ask them to listen to your heart, feel your belly. These are really simple things that are super helpful for kids. Another set of strategies that are particularly useful for adults, because again, adults don't always understand that kids can't always regulate their emotions by themselves, but they need help to be co-regulated. So the idea of telling a parent, of walking through a situation with a parent when their child really got upset, and helping them understand that their child may not be able to reason when they're very upset, and that you have to let them calm down, and that if a parent stays calm, that helps the child calm down, is a really important concept. So this idea of co-regulation, sometimes when I explain it to parents, it's like a light bulb. They think, oh, I thought if my child's upset and I get upset, they'll understand. No, they actually just get scared. If your child is upset and you stay calm and you can hold that space, that gives room and space for the child's emotion to run its course. Then when the child's emotion has run its course, you have the chance to reconnect with the child and actually help the child reason and figure out what happens. Sometimes when we're trying to help children calm down and we use words, they sometimes get more frustrated. So a trick that I love to teach kids is their own ability to use their sense of touch and their sense of imagination. So you can ask a child just to rub their hands together and then put their hands to where they want to put the energy. And you can actually have them put it where it hurts, but sometimes it's really easy just to have them rub their hands and then just put it on their heart, or rub their hands and give themselves a hug. It's a really interesting thing that when words don't work, sometimes we actually have to use the physical body to calm down. And again, that rubbing your hands together and putting your hands on your heart, it's one of those pieces that is so simple, but it's a trick that once you teach a child, it's always amazing when they actually get comfortable with that and see that it works, that they'll do it themselves. You know, another strategy that's really, really helpful for parents at this time, and this is really that important part of relationships can be very helpful in strengthening us. One strategy I use with parents that really helps comes from narrative medicine. And when I have a moment with a family, I'll ask them what or who is helping them the most right now. As a family starts talking about that, they really start feeling that support that individuals give them. So questions like, what or who supports you, or what is giving you strength right now, is really helpful. We really want to meet families where their strengths are. You can also ask them about, in the past, who or what has helped you in the past get through tough times. And another piece, just to take it a little further, is as you ask those questions, you can ask the parent to think about how does it feel in their body. So remember, as much as it's important to build skills in kids, we want to build skills in parents as well. With the parents, if we can really help them think about who's there, who helps them, that's a really important piece. Okay. So another really important stress-busting technique is exercise. And it's really interesting. Again, each individual has what works for them. I found a lot of our patients really, really resonate with exercise. And it doesn't have to be anything as big as running a marathon. Actually, just taking a 15 to 20 minute walk can go a long way. I really do recommend walking. It's very easy. It has less injuries. The other part, you can do it with somebody. So there is that other piece of regulating relationships where you have a relationship that helps you. So you get two things. You get the walking and you get the relationship. Trying to help families get to mental health services can be a really touchy subject. Families can become very resistant. One of the things that we've done that really helps with families is helping them realize that we all need someone to talk to. And sometimes it's good to talk to somebody who is a professional who doesn't have any relationship with you, but can really offer you a place where it's safe, and what they say, what you say, will stay with them. So often we kind of help families understand what it looks like and why it would be helpful for them to get mental health services. And again, it's really about that piece of helping them understand taking care of themselves helps them better take care of their kids. So today we've given you so many different tools and techniques. It's really important to find the ones that are easier for you and what work for you. Most importantly, have the ones that are your go-to, and also have enough, because really the goal here is what works for families. You don't have to try all of these, and you don't have to do all of these. Find the ones that work for you and work for your families. One of the important pieces is many of these tips can be done in this environment where we're seeing patients in a virtual way. I always like the ones that are easy to describe or easy to show on the video screen. The other part is have fun with these, because it really is a great way to connect with your families in a way that they know that you care about them as a person. And I just find that these actually help build that relationship that we always want for our families, and they really do feel supported.